Good morning. We are giving tribute to our master, Samuel Hahnemann. We remember our masters who taught us dare to be wise. So it is a wise endeavor to share the knowledge with seeking blessings from our Guru, Dr. Prafull Vijayakar sir. Sir always says homeopathy is easy and homeopathy is mathematics. So Jai Hahnemann, Jai Homeopathy, Om Vijayakar Namah. So yesterday we have learned the first aphorism, Organon of Medicine from the Samuel Hahnemann 6th edition. The physician high and only mission is to restore the sick to health, to cure as it term. And then we have read Sir's book, Theory of Separations. So today we starting with the second aphorism. The highest ideal of cure is rapid, gentle, and permanent restorations of the health or removal and annihilations of the disease in its whole extent in the shortest, most reliable, and most harmless way on easily comprehensible principle. So today we are going to read the chapter 2 of Theory of Separations, which gives every idea of this aphorism, that what should be the cure. If we don't know about the cure, then we end up with the suppressing the patients. Okay. So what Master Hahnemann has mentioned, that it should be rapid, it should be gentle, it should be permanent restoration. So sometimes we rejoice with the early success that we have cured certain cases. Mostly it happens with the early budding neophytes homeopath. Many a time they rejoice with the short results. Either it may be because of therapeutic prescriptions, or it may be because of a slight ameliorations. But we need to look at the whole endeavor of the patient so that we can understand the patient is going towards the ideal cure or going towards the separation. Or what Master Hahnemann has mentioned in this aphorism is the removal and annihilation of the disease. Now, what is the meaning of annihilation? The removal means you have removed certain symptoms. Say, for example, the patient came with you with the complaint of eczema, and you have given medicines, XYZ medicines, and after that medicines, that eczema is gone. So we consider that we have removed this disease from the surface. But does it is the complete annihilation from the body? So annihilation means nothingness or from the zero. Okay. So from something to nothing is the journey of annihilations of the disease. So that means what? There is an internal derangement that also should be cured. So that is called the annihilation of the disease. And it is in a whole extent, not a particular part. Say, for example, the patient is cured at the eczema, and now after 2 years, the patient came with the complaint that patient has bronchitis or patient having asthma. So we have seen Master Hahnemann has mentioned in the practice of Master Hahnemann from 1796 to 1828, he mentioned that I have cured lot of patients with these new methods. But what happened? Patient came with all audience are requested to keep their audio mute, please. Hello. All audience are requested to make their audio mute. So what Master Hahnemann is facing the situation, that the situation is like that he is trying to clear the cases, but sometimes the patient came with the same complaint again and again and again and again. So that he knows that this is something that is missing, and that is what the removal and annihilation is not possible. So he started the theory of chronic miasm, and then he find out that when the miasm has been removed from the patients, or the defense mechanism has been restored from the patients, organisms. So that is going to make them annihilations in the whole extent. And again, what master has made that it should be in a shortest, most reliable, and most harmless way. So that at the time of master, there is a harmful treatment available. But what he showed that this is not the way of treating the cases. And this is why he said that it should be in the shortest, reliable, and most harmless way. We have seen many cases which Dr. Vijayakar has treated, and we know that in the most harmless way, if your medicine is right, then the medicine works wonder, and you may say that it is just a miracle. It is not a miracle, it is a science. Okay. And why? Because it is based specifically on a comprehensible principle. So the principle which we are encounter, we have to understand that principles. So today we are starting with the second chapter of the theory of separations. So yesterday we have learned certain phenomenon of this theory of separations, chapter 1 and chapter. So today we are going with the chapter 2. Yesterday, one of the learners is asked the questions, what are the causes for this? So this is what our second chapter will teaches you, that the reason for separations. See, if we know what is separation and what are the reason for separation, so we have to nullify this in the form of treating the patients. So the reason for separations are mainly five, what sir has mentioned in his book. The first one is many of us homeopaths are not aware that homeopathy can also suppress. See, we have learned that homeopathy is very safe and easy, and there is no side effect. As such, there is no side effect. But homeopathy can also make the defense mechanism altered, and then this defense mechanism goes from sora to psychosis, and from psychosis it progresses to syphilis, and patient may end up with a devastated disease. So also the homeopathy can suppress. This is what Sir has mentioned. Hence, they tend to prescribe rather casually. For example, Nux vomica for constipation, okay, Ignatia for the grief, Arnica for injury, Staphylococcus for mortification. This is what something that you are using the homeopathy with the yardstick of the allopathic mind. That means what you have a symptoms and you prescribe on the basis of that particular symptoms. That symptoms should be a general symptoms. Say for example, grief for Ignatia is general, but what type of grief Ignatia has facing? There must be Natramure also facing the grief. But when you are understanding the man as a whole, then you can understand that this is not Ignatia, this is Nitramure, or this is someone else medicine. So that is what we have to understand. So sir said that this short, a small prescriptions like Nux vomica for constipation can suppress the patient from a minor ailment to the larger extent. The second reason that very few homeopaths tend to follow the Herring's law of cure. See, we always rejoice when the reports comes in our favor. Okay, I must not criticize all the learners because you all are the genius, but you need to be very precise in your prescriptions, and whenever you are showing your result to any fellow homeopath or the allopath, they have to understand that this is based on certain laws and cures. So if we know the Herring's law in a proper perspective, then and then we can say that this is what the cure is. So very few homeopaths tend to follow. So we need to follow this. This is what a comprehensible principle. Third, even if they do not want to follow, they shall never see it until the right constitutional simillimum is struck. This is what very important. What Master Hahnemann also told about that whenever you prescribe any antisoric remedy, that Shora shall be quelled to normal. So this is what Master has, Dr. Vijayakar has told us that if you prescribe a right constitutional medicine, then and then you will get the Herring's law in the favor. Fourth point, the right constitutional can never be struck until they apply the cardinal principle rigidly. So if you want to prescribe the right constitutional remedy, then you need to follow the cardinal principle rigidly. Okay, so rigidity is most important. Then the fifth point, the even if they do want to follow the law of cure, there are homeopaths. They have no definite guideline as to which is the more important organ and which is the less important organ, and what is the meaning of inside out direction of the cure and so on. So many a time I came across to certain clues, and whenever I used to go to college and I asked the student that the patient having acidity, and I have prescribed XYZ medicine for that, and after that acidity the patient came after 4 5 months. That patient says, sir, you have given a wonderful medicines. You have cured my complaints and I am feeling better. But now, sir, your homeopathy is work wonders. So give me some remedy that I have some knee joint pain and ankle pain. So if we know that what it is right directions or wrong directions. Comment your answer in the chat box. Absolutely. We are knowing because we are seeing this as that we know the miasm. We know the miasm. We know the right directions of the. So that is what Sir has given us this clue that it is wrong. But I may say, according to Herring's law, that it comes from inside out. So for stomach is inside and knee pain is outside. So it is something like inside out, and also it follow the corollary from above downward. So stomach is above and knee is down. Does it is right or wrong? Comment your answer. Wrong. Absolutely. So this is what we have to understand, that if we know the definite guideline to which organ is most important and which is less important, then and then we can understand our real practice. So Sir says that my practice of homeopathy in the first 10 years, I confess that has been far from the correct. So this is what in the early practice of the neophytes, you might be wrong. Don't worry. You are a learner and you are starting this process with the wrong and then you are correcting yourself. So don't worry. The sir has the same experience. So sir says that I used to prescribe on the single symptoms. I used to prescribe on the particular symptoms. I used to prescribe on the pathology only. And I used to prescribe on the particulars. Or sometimes sir says that I used to prescribe only on mental symptoms. Okay. So to certain extent, these things are helpful in a physiological cases, but not in the pathological cases. So not only the concept or base of prescription was different at different time, but also the posology principle also differed. Okay. So sir says, I used to prescribe single medicines, sir says the multiple medicines sometimes, and sometimes the formula. Many a times in the early neophytes homeopath, they used to do this because of survival mechanism. But this is not wrong. Okay, you start, this is the good part, and then you have to nullify your mistake gradually when you are evolving. So, sir also do like that. Sir has given the remedy in 3 times a day or even hourly. And sir confess that lack of proper guideline. At that time, there is no guideline. So right now, this is what we are doing is understanding our mistakes, and we are making a certain guideline to follow certain things. So sir says that I confess that there is a lack of proper guidelines and maybe misunderstanding of those rules already laid down in the organon or philosophy, and no standardization of the practice due to lack of scientific correlation where and are. Even today, after passing from the college, student does not know that what is right and what is wrong. So this is what our chief aim as a homeopath, to guide them in a certain extent. Okay, so the chief cause of young homeopaths going astray because of this. See, if meeting is ended in between, so you have to rejoin again. Okay, don't worry. Those who learn from their mistakes are paltry few, and those who don't and go on repeating these mistakes are plenty. So this is what we all are. So we are evolving from the mistake to the zero down of our mistakes. There are some of them who even enjoy the pride of places as good homeopath in a misled homeopathic community, making and breaking rules of running colleges by being member or leader of some or other council of homeopathy. This is what a sir's pain that it happens. To prove my point, I am here with the quoting and relating few of my cases in the first 10 years and the next 10 years of my 25 years of practice. So after 25 years of the practice, sir know that somewhere I am doing the wrong things. So this is what we have to see. I used to see a motivational video, and in motivational video they says I will share my 25 years of experience in 10 minutes. That it is what we have to do. We have to understand this 10 minutes and we have to nullify the mistakes what they have faced. So this is what sir's telling us. Sir says one case. The case is an old lady of the 60 plus suffering from the chronic migrainous headache for 15 years and was treated successfully by Sir in the initial days of Sir's practice. So she had presented with the following symptoms. She had acute frontal headache, occipital headache with severe nausea, vomiting, accompanying it, burning in the esophagus with excessive ropey salivation. There is a vomiting. It was very spasmodic and greenish in color. So after having tried several medicines for migraine, and finally, sir got the result with iris versicolor 1M repeated 3 times a day for 2 to 3 months. See, sometimes what happens when we are in our practice, we are treating the patient, and after treating that patient, we are not getting result, not getting result, not getting result. Then we started understanding that we need to prescribe therapeutically. So that what we have prescribing, and in the therapies we have compromised the principle, and then we started repeating everything, and after that we get the result. So we also rejoice and patient also rejoice. So after 3 months of this treatment with Iris versicolor, they had barely elapsed after that, and then she said that her long-standing illness started getting better, but she had developed a mild tremor in the right thumb. Okay, so this was followed by a tremor in the right hand, and within a year time, she was a full-fledged case of Parkinson's. See, look at this. Does it is a good sign or bad sign? As we have read Sir's book, that's why we can understand that it is a bad science. But today, for the last 15 years, he has been progressively crippled almost to the extent of being tremulous vegetable. So this is what we have done. So if we understand principle in right sense, then it could not be happen, and we can nullify this. Sir also says another example. The another lady coming to Sirs with the widespread baldness was completely and miraculously cured by Sir with the Vinca Minor 200 administered repeatedly for the 6 months on the basis that hair which has fallen off were being replaced by the white hair. Okay. So this case was earned me a lot of fame. So once the patient has been cured, bald patient, female bald patient has been cured and hair is replaced, but replaced with the white hair, patient is happy, but you are not, doctor cannot. So this has given a lot of fame to the sirs and by the patient, but gave my conscience a tremendous turmoil as I saw this woman develop a dreaded tumor in the breast, which turned out to be malignant. So this is what very important process that when the patient has started this. and after that patient was cured, and then patient end up with the malignant tumor in the breast. So this is what something is happening in the body interior, and that lead to the derangement. Sir also expressed sir other results. So many cases of the children with we came across this type of example. Why sir has put this example? Because sir gives the idea that where you are being wrong and where you have to nullify your mistakes. So in many cases of the children with the recurrent tonsillitis treated by sir with the specifics and mixtures have been found by me to come back with the dullness of the memory, and they fail to pass in the subject in which they used to previously secure high marks. The parents are happy that the child has overcome the disease, has developed good immunity to cold drinks and cold things and cold weathers and change of weather, etc., etc. They are happy that the child has put on weight and become chubby, but they do not relate the loss of memory or dulling of intellect to the disappearance of the cough and cold. So yesterday one of the doctor asked what are the mental general symptoms has been improved after the your prescription. So this is what very important. You have to understand what Kant has mentioned that mental means what. In mental, Kant has concluded three things: will, intellect, morals, and memory. So whenever you are prescribing any medicine to any patients, so at the mental level, you should feel first is calmness, desire to work, and desire to stamina. So this is what Sir has mentioned. It also mentioned by the Hahnemann in aphorism number 253, the signs of improvement, sign of improvement. So at mental level, his desire to do work, his will has been improved, his intellect has been improved. So previously they have to secure less mark, and now after medicine they got good marks. This is a good sign. So this is what we have to understand very small points. But here the dullness of intellect after the tonsillitis has been cured, patient becomes so chubby and healthy. So patients and patient relatives become happy, but doctor would not be. Young boy, another example, young boy with a chronic bronchitis and asthma have been treated with the remarkable acumen and relief. They stop getting attack of bronchitis and wheezing, much to the satisfaction of the parents. These children gradually changing their looks and appearance and the behavior. They become obese, the feature starts rounding, the nose changes from sharp to plump, the face changes from long, thin to flashy and pulpy. Some allopathic friends start accusing that homeopath is clandestinely administering steroid looking at the moon face. The homeopath is sure he has not administered any steroid, and though baffled, defend himself vainly by arguing that the boy was become obviously healthy. This healthy boy unfortunately starts getting tired now, tired on going upstairs, tired on cycling, on playing, and lethargy creeps in. He is blamed for his overeating and less exercise, which could be the cause of his predicament. So these are the few reasons, and there are the reason is far from any one of them. This is what very important to understand. The treatment of bronchitis and asthma was with the partial simillimum. So we have to understand where we got wrong. It is suppress the child now from the previous miasmatic disease like psoric disease manifestation to a psychotic disease manifestation. Now, what is psychosis? Psychosis, which stands as slowness, stoutiness, undercoverness, deceitfulness, and is now making the child express lethargy, obesity, false healthy look, and then obviously undercoverness is going to express itself into underlying silent disease. At the age of 14, 15 years, the boy blood pressure cells start showing higher limit. If this process is not nipped in the bud, the young boy become a frank hypertensive with the blood pressure measuring 140 of mercury, and that too at the very raw age of 20 years. So recently after COVID, we have seen many cases that I was absolutely fine after COVID, but suddenly they develop the diabetes, suddenly they develop a cardiac arrest, or suddenly they develop hypertension. So we have seen this right now that most of the after COVID, the patient was absolutely normal. Patient says, I saved from the COVID. But what happened? The patient having developed undercoverness, there is a deceitfulness, the slowness. Patient says, I was being a bit tired after I have recovered from the COVID. So this is what something is happening in the patient's perspective, and this is psychosis. Okay, so this is what you have to look for when you are encountering such cases. So sir is warning us that you have to look for this in your endeavor. So how many of us knows that in order to cure his hypertension, we have to make the psoric asthma come back transiently? See, sometimes it is very important that the patient has come to you with the psychotic or psychosyphilitic disorders, and when we are giving a medicine and patient says you that sir, ये symptoms तो मुझे पहले हुआ करते थे. So that is what you have to express that this is something which reversing back, the reversing of the patient from the destructive miasm to constructive and from constructive to the physiological miasmatic process. So you have to tell them with the example, your journey start with the one station and you reach ahead to that station. Now your journey back to your own home so that the same station will come back to you. This is what sir says that the sorry customer will come back transiently. This should be followed by the dry cough at laryngeal and pharyngeal level, and this should be further followed by sneezing and then go into skin transient soric eruption. This skin eruption also proceed in a downward direction, and above all, this should not be interfered by any medication locally or internally because the vital force itself is curing, and all along not our homeopathic medicine because the work of homeopathic single dose administered was only to stimulate the immune reaction to cure. So sir has always mentioned that this medicine, our medicine do not cure the organism itself curing it. Our medicine is just stimulating the persons in either a right direction or wrong direction. This is the same which was mentioned in the Kant repertory in the last preface. It was written that our medicine do not cure. Our medicine just stimulate the vital principle and vital principle will cure it. So this is what Sir has mentioned. So Sir says with the example, many cases of the children with the recurrent tonsillitis treated with the certain specifics and mixtures have found to be have a dullness of the memory, failing to pass in the subject which they used to previously secure the high marks. So this is what exactly you need to find out if the person having a dull intellect and when you have given a medicine, so that intellect has to be improved. So this is what the sure sign that you are treating at the higher purpose of our existence. The asthma has been made to disappear much to the satisfaction of the patients only to create the hypertension or ischemic heart disease in them. So lumbago and sciatica patients are bound to develop blood pressure problem or cardiac ischemia or heart attack if not treated properly with the allopathy, homeopathy or Ayurvedic medicine. Either any medicine can give, they'll end up with the suppression if it is not treated in a proper way. So treatment of hyperacidity end up in the pain or affection or some cartilage somewhere in the knee, back, or even nasal cartilage or thickening of the vocal cord happen. So this is what the connection from hyperacidity to cartilage, from lumbago to heart, from asthma to the heart. So this is you have to understand the connection. Putting eye drop to cure the conjunctivitis or ear drop to cure the otitis can produce cough, asthma, or pain in the wrist or shoulder or any other joint. So this is what when the patient comes to you with the shoulder joint pain, you need to ask about, do you have some otitis media? Do you have some cough? Do you have some conjunctivitis? So you can understand from there it is suppressed. And and the list is endless. So one has to realize that the disease symptom disappear only to reappear in a different system, tissue or organ. And if the reappearance is in the progressive lesser important organ, or a system, it is called as cured. And if the progress is toward the more important system or organ, it is result in the suppression. So this is what the compass for our treatment. That when you are prescribing any medicines and you have to look into the patient, that the tissue or organ or system which gives you a clue that if it is going towards suppressions or if it is going toward the cure, that is the guidance for the follow-up. So this theory is helpful in follow-up. Every homeopath who prescribe a medicines, everyone are genius. But the looking into follow-up will guide us that you are in the right direction or the wrong direction. So in the first and second case above, it is obvious that the drug Iris versicolor or Vinca minor were a simillimum to disease for a particular state, but not simillimum to the constitution. And hence, it is ended up with the removing the disease, but was not able to strengthen the constitution. So this is what we have to understand, that we have to strengthen the constitutions. So you all have understood this, you know. So any questions? You can ask on chat box any questions. So we have 5 minutes. Any questions you have to ask regarding today's reading topic? So you have to understand the which direction we are going towards. Either we are going towards in the right directions or we are going towards in the wrong directions. All are requested to share your video views so I can see you all. Yes. So I know that you are awake. Great. So happy to see you all. What about in the initial days when, due to some mistake, we surprisingly suppress the patients? Wow, that's a great question from the neophytes. Absolutely, Dr. Haley, it happens. So, Sir has shared that you have to have a mistake in your life. You have to do the mistakes. And after the mistake, you can learn that you are right or wrong. So this is what happened. No worries. Okay. Don't worry. Don't go into the state of the guilt. Okay. You are not God. We are not God. We are just the healers. So we have to do our duties in our higher purpose of existence. We are doing a certain due, but when we are started learning from our mistake, then our mistake will be nullified gradually. So it happens. I used to have a lot of mistake in my initial days of practice, and even now after the 15 years of practice, I used to have the certain mistakes. This is not no worries. Don't worry. It happens. Okay. Treatment of asthma, patient gets sneezing is good sign or bad sign? Absolutely, easy. It is. You have to see. We are going gradually with our learnings. So when we read this book gradually, you understand that why this is good or why it is bad, because from internal organ, from parenchyma, it went into the endodermal organs, and from that endodermal organ it went into the ectodermal. So this is what inside out, and that is what a good sign in the treating. So you are on the right track, Dr. Ezi, that after asthma patient having a sneezing, that is the good sign. Great. Any questions? You can unmute your mic and ask directly also. Don't worry. Absolutely. I don't know the name. Samsung SM says asking the question that once I know that I suppress it, then how to proceed further. So once you know you suppress it, the simillimum is always in the hand of you. It is right. It happens. So nature will guide you that you have suppressed it. Then the right remedy will come to your hand and nature will guide you. So it is not the process. You know that it is suppression. So you are starting with the things that I need to change my medicines. And that is why you have to look back into the patient whole history and you have to understand the patient as a whole, not the disease part. When you understand the patient as a whole, and then you can find out that this medicine is not fitted to this patient. This medicine is different. So I need to look into this and I prescribe another remedy and then you get the result. So don't worry about it. Okay. Treatment of outsider's media will develop a curve, but his anger improve. So is it good sign or bad sign? See, the emotion has to be improved in the same that it should be reduced. So, for example, the emotion is the reactions. Soric reaction is anger. But when anger got suppressed, that means the sora got suppressed to the psychosis. So we can understand anger went down. So it is absolutely wrong sign, Dr. Neha. Okay. In chronic cases, after giving medicine, if the patient came with some acute complaint, then what to do? Absolutely. You have to understand that if the body is recovering by itself or you have to intervene. Okay, many a time it happens that our medicine is making the patients to the SORA, and in the SORA, the patient came to you with the complaint, lot of complaint. So that guide us that we need to intervene, but we have to understand that the acute disease are of a two variety. One is end into self-limiting and recover soon. And the another acute disease is a psoriasis, so it is going toward the destruction. So you have to look into consideration that the patient is not going towards psoriasis. If it is in a psoric state and it is a manageable for a 2 to 3 days or max to max 7 days, you can manage it and then no worry because you have to understand from higher center the patient is recovering by self. So you need to just assist and sometime you need to intervene with the acute remedy which is corresponding with the simillimum. That is why the concept of complementary follows wells and everything is into our homeopathic field. So in that case, you can intervene. Hope you got your answer, Dr. Sejal. So thank you all. We will end our meetings in 1 minute. Okay. So hope you enjoy the learning sessions of mornings. Any inputs or anything you want to ask, you can share in the groups also, or you can share directly on my personal number. And your inputs are welcome. Any suggestions if you wish to share with, so I welcome all your suggestions also, and we will make this online web series regularly so that we can learn and grow together. So I hope we all enjoying. Thank you so much. Thank you joining us. Thank you all.